The goal of the study was to look at the overall impact of the human-animal bond or interactions with animals in people with severe dementia. So what we wanted to do was to see that would people with severe dementia be able to be influenced by nature. And for the purpose of this study, we used aquariums and wanted to look at what was the impact of using an aquarium in a centralized area on individuals' food intake, their weight, and on their behavior, and also looking at the staff and how the aquariums impacted the staff.
They were much calmer. They weren't trying to hit. They weren't trying to get out of their wheelchair. They weren't screaming. They weren't cussing. They weren't swinging their arms at you. They could sit there longer than I expected them to sit there. I just couldn't believe how long they could sit there and just stare at it. It was much calm. They were so much calmer.
They had an increase in their nutritional intake, and in the first study, it was about 21%. And then when we replicated that study in Florida and North Carolina, then it actually increased to 25%.
I did see some changes in the patients. I was surprised that some of the more combative, mean patients, I just could not believe how long they could sit there and stare at that fish tank and be so calm.
We had one man who didn't talk to us for a long time, and after we put the fish in, one day I was in there working with it, and he goes, "Fish lady," and that's what he called me. I'm like, "Yeah." He goes, "How many fish are there? Are there 6 or 8? And I said, "Well, there are 6. He said, "Well, what kind are they?" And I said, I was just trying to see what he would say. I said, "Catfish." He goes, "They ain't no catfish." The staff felt that they were able to do something positive for the resident. Often in caring for residents with dementia, it's fairly frustrating because there's really not a lot you can impact them with. And so this was a way that they could positively impact the patients, and therefore they felt more satisfied with the job and felt that they were doing a better job with the patients. Overall, it is cost-effective, it's not burdensome to the staff, and it has positive results both to the staff and to the residents. So, it's a non-chemical, you don't have to use medicine, no side effect intervention that's effective for individuals with severe dementia.